Hello, my name is Lawrence Gostin. I'm the uh, O'Neill Professor of Global Health Law at Georgetown University, and with my colleague, Eric Friedman, also at Georgetown at the O'Neill Institute. Um, I'm very pleased to be with you and to show my unwavering support for the Framework Convention of Global Health Alliance in this seminar on restoring dignity and advancing health equity through the right to health. I'll be covering a number of topics, but I'll have to do it fairly quickly because I've only got about 10 minutes or so. So why do we need a treaty on the right to health? What would a treaty look like? Why do we propose a legally binding treaty? And examples of what successful framework conventions have looked like, and also how the Framework Convention on Global Health could clarify and reinforce the right to health, as well as get us to achieve the UN Sustainable Development Goals and universal health coverage. So that's going to be my topic. So why do we need a framework convention or a treaty on the right to health? Of course, we all know the answer to this, that there's been continuing failures of countries to fully implement their health rights obligations. 72 years since the Universal Declaration of Human Rights and 44 years since the International Covenant on Economic, Social, and Cultural Rights came into force, still less than half the world's population has access to essential health services as of 2017. There's persisting discrimination against racial and ethnic minorities, women, indigenous people, LGBT populations. And there's been unaccountable health systems, unaccountable governments, and vast inequalities. For example, globally, life expectancy in low income countries was 63 years old in 2017, while in high income countries, it was 81 years old. Just in the United States, in the Wildwood community in St. Louis, largely white, well-heeled, the population lives to a life expectancy of 91 years old, where in Kinloch, a poor and largely Black area, it's only 56 years old. And I can give you examples from many countries, including Guatemala, and also Native groups, Native Americans, Native Australians, Native Canadians, and other indigenous populations. So we need a fundamental change in global governance for health to catalyze national and global actions. So what would a framework convention on the right to health look like? The FCGH is a proposed treaty with the mission of accountability to the right to health, aimed at national and domestic health equity. It would implement key human rights principles of accountability, participation, and equality. It would provide resources for the right to health, including health workers, and it would be the right to health across all sectors. We propose a binding legal obligation to take advantage of the normative power of international law, and also because countries can take seriously their obligations as legal obligations and not purely ethical or aspirational. The right to health is often used as a rallying cry, something that advocates use. But we view it as that, but much more than that. We view it as a legally binding entitlement that every human being on this planet, no matter where you live, no matter what your race or sex, no matter what your disability or non-disability, no matter what your the place you live or your income, you have the right to health. There are many governance mechanisms that we can use for the right to health, including health equity programs of action, the right to health impact assessments, um, standards for participation, including participation of marginalized populations in all health-related and other settings, multiple mechanisms for accountability and transparency, and a framework for financing and evaluating human rights implementation at the country level. The Framework Convention would clarify and enforce the right to health and reinforce that right. It would talk about actions that must be taken immediately, including in areas of nutrition, tobacco control, alcohol use, and to combat non-communicable diseases, as well of course as infectious diseases, as we're seeing human rights trampled and equity exacerbated during the COVID-19 pandemic. Non-discrimination and justice are key maxims of what we want to achieve. And we also want to ensure international assistance and cooperation. We all know that the United Nations Sustainable Development Goals and its key target, universal health coverage, are extraordinarily important. And we need to fill gaps in the 2030 Agenda for Sustainable Development. We don't want to leave anyone behind, which is the United Nations pledge to the world's population. And so we need to fill those gaps by strengthening accountability. We need coherence for health across all of the goals. We need inclusive participatory processes. Universal health coverage has to be truly universal, affordable, free at point of service, and it needs to reinforce non-discrimination principles throughout. Beyond the SDGs, the Framework Convention on Global Health would establish rights-based legal frameworks for a post-2030 health-related sustainable development goals. And so we have an ambitious agenda. Eric Friedman and I, with so many amazing partners around the world, and the just simply remarkable Framework Convention on Global Health Alliance, which has been a catalyst for change. How can you get involved? How can you help achieve the vision of a world filled with not just health, that is ever increasing health outcomes for things like AIDS, TB, malaria, NCD, child health, maternal health and safety, and also longevity, but also justice, that is the equitable distribution of the global public good of health to all peoples around the world, truly fulfilling the United Nations promise to leave no one behind. In my view, even before the COVID-19 pandemic, the world was achieving greater public health outcomes, but with less justice. And the prevailing global social narrative was a narrative of inequity. And as Martin Luther King said, all inequalities are unconscionable, but health inequalities are particularly unconscionable. So we need both health and we also need justice. So what you can do for a start is to join the Framework Convention on Global Health Alliance or contact the FCGH Alliance for more information and see how you could get involved. The Alliance website URL is fcghalliance.org. Write to or meet your political representatives to educate them about the Framework Convention and encourage them to support it. That's really important. We need country level support at the UN, at WHO, in order to get this through. Share information about FCGH through your social media. Tell your friends, family, colleagues about the convention. Write an article or post a blog, or send a Twitter message or other social media message about the FCGH. You can follow me on Twitter or tag me in the FCGH tweets that you send. I'm at Lawrence Gostin. Offer your feedback on several parts of the FCGH draft through the FCGH Alliance website, or just contact any of us. Now, you might say, we can never do this. And even if we did it, it wouldn't make a difference. But it will make a huge difference. The Framework Convention on Tobacco Control was once thought unimaginable, but now it's in force, and it's changed the world to reduce smoking enormously. We can do the same thing with a right to health treaty. So join Eric, me, the Framework Convention on Global Health Alliance, roll up your sleeves, and start fighting for the right to health and the right to justice. Thank you. It's great to be with you.